Hello and welcome. I'm Mamu Kasatiani, and in this course we'll talk about general pharmacology. Let's start with general terms. A drug is any substance that can induce changes in biologic function through its chemical actions. Pharmacology is a study of substances that interact with living systems through chemical processes. A poison is a drug that has harmful effects. A difference between drug and poison can be only a dose, because in high dose every drug can be a poison. As Paracelsus famously stated in 16th century, the dose makes poison. A toxin is a poison of biologic origin, in contrast to inorganic poisons such as lead and arsenic. Toxicology studies the harmful effect of poisons and toxins on living organisms. Plants were a major source of drugs in the past. In the left picture, you see a Papaverum somniferum, opium poppy, which is a source of morphine. In the middle, it's Digitalis purpura, foxglove, a source of digoxin. And on the left, we have Spirea ulmaria, a meadowsweet. Aspirin was derived from it. Not very long ago, doctors used plants for treatment. Nowadays, we have synthetic derivatives of active chemicals from plant or animal sources. For example, scientists discovered that Brazilian pit viper venom contained a peptide that could lower the blood pressure by inhibiting angiotensin-converting enzyme, and they created the inhibitor of the angiotensin-converting enzyme, captopril, a very popular antihypertensive drug nowadays. Modern engineering now gives us ability to create drugs. However, approval of the drugs requires years of research, sometimes decades, and a lot of finances. We have gone a very long journey from using just random plant as a treatment to creating monoclonal antibodies or treating via the messenger RNA-based drugs or accelerating drug-making process by the artificial intelligence. First of all, the drug is tested on two species of the animals in preclinical study, from which one is a rodent, usually a mouse, and another one is non-rodent, usually a rabbit. After that, drugs are tested on humans in clinical trials, each phase having a different goal. Phase 1 clinical trial assesses safety of a new drug in small number of the healthy volunteers, approximately from 20 to 100 people. Phase 2 evaluates the effectiveness of the drug in a moderate number of the diseased individuals, approximately between 100 to 200 participants. This phase aims to determine whether the drug works or not and defines proper dosing. Phase 3 involves a larger number of the patients, usually more than 1,000. The study is randomized and can be placebo-controlled. This trial determines whether the new drug is superior to the placebo or a standard of care. If a new drug is better than the placebo, then a new generic drug is approved. After new drug approval, a Phase 4 clinical trial involves a post-marketing surveillance. It includes thousands of patients with disease to determine long-term adverse effects, risks, optimal doses, treatment schedules, and drug interactions. To summarize, Phase 1, 2, and 3 establish safety and efficacy. Phase 4 determines long-term adverse effects, risks, optional doses, and treatment schedules after the drug is approved. A general pharmacology has three main parts: pharmacokinetics, pharmacodynamics, and pharmacogenomics. Pharmacokinetics studies drug absorption, distribution, metabolism, and elimination, or to simplify, what the body does to the drug. Pharmacodynamics will study what the drug does to the body, and pharmacogenomics studies how genetics can influence the treatment, or why one drug works for one patient and not for another. To facilitate learning and understanding, I have a model for you. This is how I approach this subject. In medical school, you studied basic subjects such as anatomy, histology, chemistry, biochemistry, physiology, etc. These subjects have one thing in common. They will teach you how a healthy human being functions under normal conditions. I call these normal subjects. And after studying these normal subjects, you studied pathology. To oversimplify these, pathology will teach you that there are no normal processes happening anymore and you have a disease. And after that, you have pharmacology. First, you need to recognize what's normal. Then something breaks down and you have a pathology, a disease, and then in pharmacology you have a treatment of this disease. Many people think that the pharmacology is all about drugs. Well, it's partially true, but the subject is about knowing what's normal, understanding what's the mechanism behind the pathology, and knowing how to fix the problem. That's the pharmacology. If you want to master the subject, you need to know four main things about the drugs: name, mechanism of action, clinical use, and side effects. Mechanism of action is based on physiology or biochemistry. Clinical use will be based on pathology. Here are diseases against which we use drugs. After explaining side effects or adverse reactions, I will tell you some additional information regarding pregnancy, breastfeeding, and some notes in which we have additional information regarding the drug and mnemonics. And finally, a bit information about myself. My name is Mamuka Satiani. I'm a cardiologist and I work in the cardiovascular intensive care unit and catheterization laboratory. Additionally, I have some experience in cardiovascular anesthesiology. I have 7 years of teaching experience to international medical students and residents. I find this subject most clinically relevant as I use this knowledge every day in my clinical practice, and by making this course, I would like to share my experience and knowledge to you. I promise I will not teach you anything that you will not be using at the hospital every day, and it does not matter in which medical field you are in. I think the most important is how you use your knowledge. Knowing more in pharmacology will give you ability to prescribe and use less drugs. If you understand and follow me carefully, this course will be a Fullagonist for your pharmacology receptors. It's my great pleasure to be with you in this lecture course and to wish you all the best of luck in your journey in pharmacology and beyond.